Welcome everyone. So in this episode, I wanted to talk about stress and recovery measurements with using heart rate variability. So talking about how those can be used and also giving ideas, different kind of devices that can be used to measure heart rate variability in normal daily life. And heart rate variability, or HRV, is one of the most reliable indicators of how well the body manages stress and recovers. It reflects the balance between sympathetic and parasympathetic branches of the autonomic nervous system. And it's a nice signal because it's relatively easy to measure the HRV, and it's also a signal that it doesn't take much space, it doesn't take much computation to have it. It's just the milliseconds between successive heartbeats. So it's a very nice signal in many ways. And HRV has applications across numerous research areas, including wellness, sports science, clinical studies, and behavioral interventions. And we at Fibion, we provide several tools to simplify HRV measurements. So we have a device on the wrist which uses optical sensor to measure very easily during the waking hours and sleep hours heart rate variability. Then we have a device that can be attached on the chest, and it's measuring ECG based. So it's basically measuring the electrical activity of the heart. So this is the most accurate way of measuring the heart rate variability. And when you measure like this, you can also record the full ECG curve, so the PQRST complex, which can have some advantages in some more clinical applications. And we also have a bed sensor that you can put under the mattress, and it will be measuring heart rate variability with ballistocardiography. So it doesn't even need to touch the participant. It's basically when the blood is rushing down the aorta, when the heart is pumping, there is a momentum there, and basically the body starts to sway as a force and counter force against this, and this can be detected with the ultra-sensitive bed sensor like Fibion MFit. And then if we look to understand the HRV better, so as said, it's the time between consecutive heartbeats. And this is quite variable. It's basically controlled of the sympathetic and parasympathetic nervous system, and it changes quite a bit. And higher heart rate variability, so more variability, is often associated with better recovery and resilience to stress, and it also indicates usually higher aerobic fitness, while lower heart rate variability can indicate heightened stress or poor recovery. And key applications of heart rate variability is to evaluate stress responses, so we can do this during the normal daily life. We can monitor recovery, usually during the night time, but also small times, for example, taking a break from work or having a nap. We can also monitor recovery during the daytime. And then we can assess the effectiveness of lifestyle or medical interventions. And if we think a little bit example applications of stress and recovery research, quite a common thing is to look at workplace wellness. We spend a lot of time in the work, and especially knowledge work. It's usually quite stressful. So we can monitor with heart rate variability how employees respond to stress during work and recovery at home. And for example, at Fibion, we did a project with the emergency call center. So when you call 112 or 911, depending on the country, the people who respond there, it's pretty stressful. People always call them when it's an emergency, and they actually work 12-hour shifts. And for security reasons, at least in some countries, they don't have windows in those, but they are windowless. basements where they work and they don't see much daylight and they work 12 hours, super stressful work. So it was quite important study to do with these workers. And then it's pretty common to use it in sports science. You can measure recovery during the night, and basically you can detect if there's overreaching or overtraining coming, and you can usually train less before it gets severe. And it's very useful for sports science. And you can, for example, measure the nighttime HRV and assess the readiness for the next day. And if you're not well recovered, it's maybe not the best idea to do the hardest training. So you can use it to time the hard trainings in the correct places in the week. And for example, in clinical studies, you can evaluate how interventions such as mindfulness or certain medication impact stress and recovery in patients. Or you could have behavioral intervention where you track the physiological effects of lifestyle changes, such as improved sleep habits or regular physical activity. And then if we think a little bit of choosing the right tool for heart rate variability measurements, I think the first thing is that do you need both waking hour heart rate variability or do you need just the sleep time? And if it's only the nighttime, then the bed sensor is very nice because people don't need to wear anything. They don't need to charge anything. It's just automatically measuring the heart rate variability and many other metrics from every night. But if you need the daytime and you need continuous daytime, then I think you are between a wrist-worn optical heart rate variability sensor or chest-worn ECG-based heart rate variability sensor. And if you need very accurate, I would go with the chest attached electrodes, medical electrodes, and a chest worn device for the most accurate measurements. Although now, for example, with Fibion Helix, it has patented technology for the wrist-worn optical measurements. It's basically filtering out the movement artifacts very efficiently. It can also provide very good accurate heart rate variability info from the wrist. So it comes a little bit on the convenience, the preferences of the participants, whether it should be the wrist-based or chest-based measurement. So as a conclusion, HRV is a vital metric for understanding how people manage stress and recover from the stress. And it's a very easy signal to measure, and it gives very nice insights into the autonomic nervous system action. And hopefully you got something valuable from this episode. And if you're interested to learn about Fibion's solutions to measure heart rate variability, please check our website at fibion.com, and from there you can book a call with me or Dr. Miriam Caprita, and we are glad to help you and see if our solutions could be a fit for your project. Thanks for listening and have a brilliant day.